Well, Assalamu alaikum and good morning, everyone. Thank you for coming here. This is our first session in Heel Green Village Hall. We have been working from Longside Library before, but this is local and there aren't many activities in this area, so we decided to move here and obviously run our awareness session from here, because as much as awareness is given, it's never enough. You know, we need to do more and more. We need to cover other areas as well. At Creative Minds Media, just very briefly, the people who've been here, they know that what we do, but what our values are, very briefly, I'm going to say, empowering. We want to empower women by providing them with tools, resources, and support they need to succeed and thrive. Collaboration, working together with individuals, organizations, and communities to achieve our goal. And inclusion. We want to embrace diversity in all forms, and we believe in creating a safe and welcoming space for women from different backgrounds, cultures, and experiences. And education and awareness. We believe in the power of education and awareness to challenge societal norms, break stereotypes, and promote gender equality. We will arrange workshops, which we have been doing for last over a year now, and awareness campaigns to educate the women. And in future, we are actually looking forward, we are planning to arrange skill building workshops, confidence building, digital skills, and other areas. And also community engagement. We actively engage communities to foster positive changes. We offer support to overcome challenges, encourage women to equally participate. So I would encourage and urge everyone to join us in our mission for a better and healthier society and community. And today we're going to talk about the importance of cancer screening. I've got Farzana Chaudhry with me and Nabila Farooq. So please give a big round of applause for Nabila and Farzana. Nabila is also part of our team, Creative Minds Media. Farzana Chaudhry, I would like to introduce. She is breast cancer screening lead and Answer Care engagement lead. Answer Cancer engagement lead. And Nabila Farooq, Nabila is cancer screening improvement lead from NHS. They both work for Manchester Foundation, Trust, and NHS. And their roles are to improve uptake of breast screening. So we're going to talk about, are you going to cover mammogram, X-ray of breast for early diagnosis of breast abnormalities and cancer? So Nabila will be doing that about the breast screening, and I'm going to say what you're going to do, and then I'm off the mic here. And Farzana, she will be covering bowel screening and cervical screening. So Nabila to present breast screening. Round of applause for Nabila.
Right, okay. So, जैसे फरजाना जी ने बताया कि me and Farzana, we both work for the NHS breast screening unit, which is based at the Nightingale Centre within Shaw Hospital. So first of all, I'm going to just sort of like go through. So, without giving your age away, how many women have had a mammogram or an X-ray of their breast? Right, brilliant.
Full house?
Full house. Do we go regularly? Regularly? Yes.
Yep. When they send a letter?
Yes, every 3 years. So, oh, that's good. So the ones who are young yet, so obviously we'll be talking about breast screening, but also we'll be talking about the signs and symptoms, कि कैसे आपने आपको, you know, regularly check करना चाहिए and keeping yourself healthy. So basically, NHS का जो breast screening program है, it started in the 1980s. में शुरू उन्होंने किया था, and the purpose of it is that कि उनको पता चला कि अगर हम breast का X-ray करेंगे, mammogram करेंगे, we can catch cancer very early. और कोई और भी abnormality हो सकती है, ज़रूरी नहीं है कि वो, you know, वो cancer हो, किसी वक्त fatty tissue होते हैं, किसी वक्त cyst होते हैं. So the whole purpose of the NHS breast screening is to be able to catch something very early. And जैसे ये लिखा हुआ है, you know, I'll talk through this. So, every 3 years from the age of 50 to 71, आपको लेटर आएगा अगर आप GP के साथ रजिस्टर हैं. अगर आप GP के साथ रजिस्टर नहीं है तो फिर आपको खत नहीं आएगा. So it's important, and I know I know majority of us will be registered with a GP, but किसी वक्त ये होता है asylum seekers, refugees, कई लोग नहीं करते, वो address बदल लेते हैं, घर बदल लेते हैं, पर अपना GP practice नहीं बदलते. So अगर वो GP practice नहीं बदलते और उन्होंने पुराना address रखा हो, फिर वो letter पुराने address पे जाएगा. It won't go to your new address. So that's why it's sometimes important. हमें यही होता है और नहीं हमने GP नहीं change करना ज़रूरी है. But for things like this, it's important that you need to change your GP. So every 3 years आपको खत आता है, उसमें अपॉइंटमेंट लेटर है और उसमें लिखा होता है कि आपकी ब्रेस्ट स्क्रीनिंग ड्यू है, टाइम, कहाँ पे आपने आपकी अपॉइंटमेंट है एंड फॉर हाउ लॉन्ग, यानी वो सारा आपको बताता है. उसके पीछे हमारा QR कोड है, अगर आपको फर्दर इंफॉर्मेशन चाहिए होती है तो वो उसको स्कैन करे, वो ले जाता है वेबसाइट पे, you know, the NHS website where it will sort of give you more further details about your mammogram. अगर आप पहली दफ़ा जा रही है तो उसमें ये पिंक लीफलेट होगी. So अगर आप हमारी वेबसाइट पे जाएं या NHS की वेबसाइट पे जाएं, या आपको over 20-30 languages you can obtain these in. So it's quite important कि you know आपको पता हो कि आप किस लिए जा रहे हैं, क्योंकि कई होते हैं ओ नहीं you know ज़रूरी नहीं है, या ओ हमें तो ब्रेस्ट कैंसर नहीं है, why do we need to go for a mammogram? Again, and it's really important that you understand what breast screening is. So it's the early diagnosis of anything that's abnormal in your breast. So आप जाते हैं, आपके अपॉइंटमेंट लेकर आती है, and you go to the breast unit. हमारी 3 mobile unit है. So we have one in the north of Manchester. अगर किसी वक्त वो North Manchester General Hospital में है, कभी it's at the Ittihad at the tennis centre, and एक दफ़ा हमारी वो Arcadia में थी 11 June में. So we try to bring it to as near as where you are. Here हमारी stretcher, the ones that we are at, one's at the Nightingale Centre, जो Withenshaw Hospital में, एक Withenshaw Community Hospital में है. So we have those, and depending in Trafford, वो भी हमारी mobile है. So depending on where you live, हमारी वो mobile units उस जगह पे जाती है. And then we cover Manchester, Salford, Trafford, Tameside and Gloucester, and Oldham. So I know a lot of you aren't from this area, Stockport area, but depending on where you live, you will be invited to the closest unit going for your screening. Questions होंगे, जैसे कि अगर आपको पहले breast cancer हुआ है, mastectomy हुआ है, lumpectomy है, implants है, any questions that might impact your mammogram. और अगर आप पहले भी गए हैं और आप वो जिसने किया है आपका एक्सरे, आपको दर्द हो रही है, आप उसको बताएंगे you know previously मैं आई थी तो वो दर्द हुई थी, तो वो फिर एडजस्ट कर लेती है, क्योंकि वो जाहिर है वो एक्सरे मशीन है. आफ्टर दैट वो आपको पहले तो गाउन देते थे, जाहिर है अब वो गाउन नहीं देते, वो सेविंग मनी इन द NHS गाउन नहीं देते, वो कमरे में लेके जाएंगे, आपको बोलेंगे कि आपके पूरे ऊपर के हिस्से के you know कपड़े उतारे. The ones who have been will know, you know, and then फिर आपकी एक्सरे मशीन पे लेके जाएंगे, and they will take 2 images, 2 एक्सरे करेंगे each breast के. Yes, it's uncomfortable because it's like a plate. वो आपके breast को compress करते हैं, because we need to get accurate readings of your breast. Right. After 2 weeks, आपको खत आना चाहिए, everything is normal. के बाद बुलाएंगे. अगर कुछ नॉर्मल नहीं है या वो एक्सरे ठीक नहीं है, they will recall you. आपको फिर दोबारा बुलाएंगे, वो नाइटिंगेल सेंटर में आपको बुलाएंगे कि हमने दोबारा वो एक्सरे करना है. अगर खुदा न करे को वो उधर कुछ है, then you will get referred to the oncologist, which is a cancer specialist doctor. You know, वो आपको उधर रेफर करेंगे, फिर आप सिम्प्टोमेटिक ग्रुप पे चले जाएंगे. फिर वो जो आपको कंसल्टेंट होगा, ब्रेस्ट नर्स आपको मिलेगी, वो आपको सारा एक्सप्लेन करेंगे कि you know what's been diagnosed, कैंसर डायग्नोज हुआ है या कोई और abnormality डायग्नोज, वो सारा आपको एक्सप्लेन करेंगे. जाहिर है वो परेशानी तो होती है जब आपको कोई कहता है oh you know it's breast cancer or any kind of cancer. So sometimes it's best to take somebody with you, या नोट लिख ले, पर जरूरी नहीं, you know you can request a second appointment. और वो ये होता है कि अगर आप डायग्नोज हो, अगर आपका नॉर्मल है तो आपको 3 साल के बाद फिर बुलाएंगे. जैसे मैंने बताया वो 50 to 71. Before 50, they don't call you for a mammogram because of the density of your breast tissue. क्योंकि वो किसी वक्त वो abnormal reading आती है तो फिर वो सही नहीं होती, और वो breast reading सही. हाँ, अगर आपकी family history है और हाई रिस्क पे है, फिर वो आपको या हर साल बुलाएंगे या पहले 50 से पहले बुलाएंगे कि आप जा नहीं सकते। The only difference is फिर आपको खुद हर 3 साल के बाद ब्रेस्ट स्क्रीनिंग यूनिट को फ़ोन करके अपॉइंटमेंट बनानी पड़ती है। So there's nothing stopping you after 71, and we encourage women that after 71 they should be going, because the higher the risk and is when you're growing older, over the age of 50, 60, 70, your risk of getting any kind of cancer increases with age. So it's quite important that you know that you carry on going after 71. Again, अगर आपको अपॉइंटमेंट सूट नहीं करती जब आपको वो खत आता है, you can ring up and change that appointment. क्योंकि कई दफ़ा यही होता है, हाँ नहीं हम तो जा नहीं सकते, हम चेंज नहीं कर सकते, and we leave it for another 3 years. या किसी वक्त ये होता है कि हम खत खोलते हैं और भूल जाते हैं. We forget that we have an appointment महीने 2 के बाद, oh my god I had an appointment, खाते ढूंढते हैं. You can still make an appointment. जब हम आपको भेजते हैं लेटर, उसके 2 या 2.5 साल के बाद तक आप अपनी स्क्रीनिंग पे जा सकते हैं. So there's nothing stopping you from making an appointment for up to 2 to 2.5 years after your original invite. So it's really important. In between your breastfeeding appointments, क्योंकि वो 3 साल के बाद होती है, तो उसके दौरान आपको क्या करना चाहिए? What should you be doing?
Observing.
Yes, checking yourself. Do we all do it?
Yes, we do.
हम भूल जाते हैं. देखिए आप ऐसे देखें क्या करते हैं. So we can sort of like get the thingy. और सबसे ज़रूरी बात ये भी है कि अगर आप कैरियर है या आपके घर में बेटी या आपकी बहन या कोई भी रिश्तेदार have got learning and physical disabilities, ज़ाहिर disabilities तो है, अगर वो खुद खड़े हो सकते हैं, अपना बॉडी वेट उठा सकते हैं, व्हील चेयर में नहीं है या अगर व्हील चेयर में भी है तो फिर वो स्क्रीनिंग कर सकते हैं. But अगर they can't take their own body weight, unfortunately we can't screen them. पहले हम बुला लेते थे नाइटिंगेल सेंटर में अल्ट्रासाउंड या कोई और कर लेते थे, but we don't offer that now. Only in rare facilities, क्योंकि हमारा जो प्रोग्राम है ना ग्रेटर मैनचेस्टर का सबसे बिजी है पूरे इंग्लैंड में. So because of that, if women aren't coming, एक तो हमने दोबारा छोड़ दिया था दोबारा उनको बुलाना. यूजली ये होता था एक खत जाता था और अगर आप उस खत पे अपॉइंटमेंट पे नहीं आए, we used to send you another one. But since COVID we have stopped sending a second invite. But next month we are introducing our second invite because हमारा प्रोग्राम अब लेवल पे आ गया, क्योंकि कोविड के बाद सारे हम भी 6 माह के लिए बंद हो गए. फिर जो जिनको नई स्क्रीनिंग पे बुलाया उनको बुलाना था. तो ज़रूरी है because काफ़ी रिपोर्टें भी आई हैं that you know women are missing their mammograms, so you have to be screened within the 36-month period. So if you have not received a letter within 3 years of your original screening, and you need to contact the breast screening unit. It's really important that you do that. काफ़ी औरतें होती हैं, you know, क्योंकि जब वो screening करते हैं ना, if there is a cancer, we pick it up at a very early stage. जैसे अब आप अपने आप को रेगुलरली चेक करते हैं, गिल्टी होगी, कुछ और होगा, that is later stage, क्योंकि तब तक तो वो बढ़ गया होता है. जब वो स्क्रीनिंग से पकड़ते हैं, वो तो इतना सा दाना से भी छोटा है कि आपको नजर नहीं आता, वो माइक्रो, so they can treat it रेडियोथेरेपी से, या वो बस वो उतना हिस्सा वो बस you know निकाल देते हैं, बिल्कुल छोटा सा by incisions. पर जब आपको you know जब वो बढ़ जाता है, जब आप खुद सेल्फ चेक करते हैं, सिम्टोमेटिक ग्रुप पे जाते हैं, your treatment pathway is totally different. किसी वक्त ज़ाहिर लम्पेक्टमी होती है, फिर कीमोथेरेपी, रेडियोथेरेपी, फिर हार्मोनल थेरेपी, या किसी वक्त you know mastectomy, पूरी you know वो ब्रेस्ट उतार देते हैं कि वो स्प्रेड ना हो, फिर उसके साथ वो lymph glands आपके निकालते हैं because that's important कि वो आपके जिस्म में नहीं स्प्रेड हो रहा हो. So that's why it's important that you go for your mammogram. और हमारी औरतें नहीं जाती, हमारी especially we say about the black and the Afro-Caribbean, वो तो फिर भी हमसे थोड़ी सी बेहतर है कि वो चले जाते हैं. हमारी जो South Asian women है ना, वो नहीं जाते. And
maybe lack of
awareness, understanding. वही तो मैं कह रही, जब हम सेशंस करते हैं
लोग कहते हैं वो जो स्क्वैश करते हैं ना, उसकी वजह से नहीं करते,
पर वो 10 seconds के लिए होता है. वो बेहतर है कि अर्ली डायग्नोसिस करके, लेट डायग्नोसिस करके, वो जो ट्रीटमेंट पाथवे वो उससे भी सख्त है. ज़ाहिर रेडियोथेरेपी, कीमोथेरेपी, ऑपरेशन, सब कुछ वो उससे भी है. सो तो बेहतर नहीं है वो 10 सेकंड या 15 सेकंड, वो अनकंफर्टेबलनेस. बर्दाश्त। और अगर आपको दर्द भी होती है वो मशीनें मैनुअली भी एडजस्ट हो सकती है। अगर आप मैमोग्राफर को बताएंगे ना कि नहीं मुझे बहुत दर्द हो रही है, then they'll do it manually। पर आपको बताना पड़ेगा। अगर आप कुछ नहीं कहेंगे और बस अनकंफर्टेबल फील करेंगे या कुछ, तो आप उनको बता देंगे look it's hurting me, I'm uncomfortable, they will adjust it manually। So that's quite important that you do that। So like I said, give a second appointment about next month, it is next month isn't it fine? Second invites, yeah next month say second, क्योंकि अगर आप पहले appointment पर नहीं जाएंगे तो second invite हम आपको भेजेंगे। उसके बाद अगर आप नहीं आएंगे फिर हम आपका रिकॉर्ड बंद कर देंगे। पर ये नहीं है कि आप फोन करके दोबारा नहीं जा सकते। But it's important that you spread the message to your family, to your friends। So over 71 आप फोन करके हर 3 साल अपनी अपॉइंटमेंट बना सकते हैं। उसके दौरान regularly you need to check yourselves। Under 50 I always recommend from the age of 15, 16 you should teach your daughters to check themselves regularly। Because symptoms, and a lot of Asian women are getting breast cancer in their 30s, 40s। So it's really important that we check ourselves regularly। And इसमें कोई नहीं है, आपने कौन सा किसी के सामने अपने आप को चेक करना है। शावर में जाएं चेक करें, लेटे हैं चेक करें, शीशे के सामने हो, कपड़े बदल रहे हो, you need to check yourself। So it's really important that you understand what the checking is। So just a bit about breast awareness। क्या symptoms है? अगर आप अपने आप को चेक करें तो क्या symptoms है?
Lumps,
Yes।
change of color even, sometimes
Change of colour, yeah।
Sometimes a lump is very small, you can't even see it.
Yes, that's why we tell you to check it। Feeling, वो ये होता है, वो कहते हैं ना ये 4 fingers, you need to check yourself all over your breast। इधर से लेके,
There's a breast there।
yeah, I'm going to show it।
Yeah.
इधर तक, I'm just showing the area। इधर तक आपका कॉलर बोन है, उधर भी उंगलियां लगाएं क्योंकि आपकी lymph glands है इधर। There, neck, under your breast, under your armpit, अंगूठे के साथ, see if there's any lumps there। So you need to make sure that you check the whole area, not just your breast, the whole area। आपको check करना चाहिए, especially under your armpits। And we have got a breast here that Pfizer's kindly brought। And has it got lumps in this,
Yes,
Pfizer?
it has. Little ones, small ones, big ones।
Can't find it anymore। Yeah, so it's like you say 4 fingers के साथ अपने पूरे breast को आप check करें। प्रेस करके डीपली। शावर में जब आप लेते हैं सोने के लिए फिर भी चेक करें क्योंकि आप डिफरेंट पोजीशंस में हैं। So you can check yourself। किसी ने फील करना है, you can come and feel it।
ब्रेस्ट पे एक्सरसाइज
Pardon?
मैंने कहा सुबह उठ के ब्रेस्ट पे एक्सरसाइज करनी
Yes। No, every 4 to 6 weeks अगर आप चेक कर लेंगे, especially if you're having your periods as well। Obviously after menopause as well, but when you have your period। So किसी ने कहा lump, change of colour, Cyrus said over there। What else?
डिस्चार्ज
Discharge, yes। Discharge from where?
Nipples।
Nipples, yes। So you're not breastfeeding and you've got a discharge। Now we do say sort of like a clear fluid, but when we sort of like we train, we can say any kind of discharge that you're not comfortable with, आप जाके check कराएं। Any discharge that's coming from your nipple। Change in the size of your breast। अगर आप शीशे के सामने regularly अपने आप को check करते हैं, आपको पता चल जाता है oh no my breast size is the same, bra size same है एक। और किसी में कुदरती होती है one breast is bigger than the other, one is smaller। Yeah, you know that। But जब आप regularly check करेंगे and one becomes bigger than the other, then you will know oh this wasn't there before। Dimpling of the skin, जैसे orange peel नहीं होता, वो जैसे eczema की rash या ऐसे, that kind of a rash। Anything that's not, anything that does not go, anything that's unusual, even a dimpling। I can remember it was in the Daily Mail a number of years ago। ना एक औरत थी कहती मैं शीशे के सामने खड़ी हुई और बस छोटा सा डिंट था मेरे breast में, बिल्कुल कहती है नजर पर, कहती मेरी नजर पड़ गई उस पे। And she went and got it checked and it turned out to be breast cancer। Another woman that we know, she had a spot on her breast and she peeled it। Yes, I'm looking at some people। And she peeled it and just near her nipple and उसमें खून निकलना शुरू हो गया। She went to बंद नहीं हो रहा था, then she went to the doctor and it was diagnosed with breast cancer। So anything that's not normal, you check yourself regularly। Like we say, dimpling of your skin। You might think okay चलो हमें eczema की rash है या कुछ holiday पे गए हैं, heat rash, If it doesn't go away, you need to get it checked. You find a lump, you need to go to the GP straight away. GP पे जब आप जाते हैं किसी वक्त ये भी होता है lump, you know, कुछ abnormalities नजर आती है. We're in the GP and she goes, oh, we haven't got an appointment for 2 to 3 weeks. You need to say that. I know it's really uncomfortable कि हम कैंसर का word नहीं use करना चाहते हैं. वो किसी वक्त वो 100 बीमारियों से गुजरते हैं तो वो उनके mind में नहीं होता है. So you need to sort of like say, look, I want to rule out it's not breast cancer. कोई rash हो जो नहीं जा रही.
Right.
Change in size.
Right.
Change in size. Change in colour. किसी वक्त एक छाती भारी हो जाती है एक नई, you know, so anything कि नहीं आपको सही लगता है. कोई गिल्टी हो यहाँ spot हो.
अच्छा अगर कुछ लोगों को मैंने देखा है कि पीरियड से पहले उनके ना पेन स्टार्ट हो जाती है.
That's why we say period के बाद हफ्ता 10 दिन के बाद अपने आप को चेक करें क्योंकि कहीं के lumpy breasts हो जाती है period में, you know, they do get quite lumpy breasts. But so it's just important that we say 7 to 10 days after your period, so it's you get sort of quite clear.
ये कोई dangerous तो
नहीं वो फिर आप चेक करेंगे तो आपको regularly आपको पता चल जाएगा. So now that is the breast part. So I'm going to hand myself over to Farzana now, who's going to do bowel screening and cervical screening, which is also important. Because NHS के 3 program है.
I'm going to ask that question. So you can't
So,
say.
oh, sorry, darling. So hand you over to Farzana.
Thank you. Assalamualaikum. My Urdu isn't as good as Nabila's, so I will try, inshallah. So my name is Farzana. I work for the Anti-Cancer Program as the engagement lead, and also I work as a cancer screening improvement lead for breast screening to improve breast uptake. And as Nabila was saying, it's really important that we come to these sessions and we listen and we take it away and we do things. So I did a session in Longsight. We talked about the signs and symptoms like Nabila was saying, and there was a lady in there that was under the age of 50, not screening age, and she got a little bit of she had a little bit of a dent in her breast, like a tiny little bit of dent. And she said to me at the end, she came over and she said to me, oh, I've got this little dent in my breast, what should I do? It's nothing, it's tiny, but it was not normally there, so I said, go and see a GP. So obviously I did the session, and then I went away, and then we don't go back to the same group. Then I was running another event in Longsight 6 months later, and she came up to me and she said to me that I went to the GP, I got diagnosed with breast cancer straight away. Well, she obviously then she went to the GP, then they sent him to the, you know, Nightingale, and they got investigated. And she got diagnosed with breast cancer, but it was only stage 1, and because she caught it really early, obviously she'd recovered, gone through the treatment. Alhamdulillah, she was under 50. She was like, I think she was like 35, 40, so young. And she said, I would never ever have realised that would be a thing that I need to go and see to the GP about. She actually thought lump. We all know about lump. We think, oh, every time we think about breast, we always think about lump. And so that's so it's really, really important that the information that we get here, we don't just listen to it, we take it away and we check ourselves regularly, we see what's normal for us. And also the whole idea is that we give you that information, that you share it with your friends, with your daughters, with your communities, so we're getting the message out, because we can't reach everybody. We do try, don't we? But we can't reach everyone. So inshallah, you know, if we catch it early, then, you know, this is an amazing success
I
rate.
was just going to say, हमें ये होता है कि किसी वक्त yes hereditary होता है, but a majority of it is not hereditary. एक आई थी वही session, एक और session था Longsight में हम कर रहे थे, तो उसकी अम्मी को था, right? वो mammogram के लिए गई, उसको breast cancer diagnosed हुआ, तो उसको भी थोड़ा शक पड़ा. She goes अपने GP पे गई. She goes, I'm 40, I think she was 47, 48. She goes, मेरी अम्मी को breast cancer. अब मैं भी थोड़ी सी uncomfortable feel कर रही हूँ. I just thought, and उन्होंने उसका mammogram किया and उसको भी diagnosed. So mother and daughter at the same time were diagnosed with breast cancer. अपने थे, you know, so that's why it's important. हमारी South Asian communities में ज़्यादा और late diagnose इसलिए होता है क्योंकि हम जाते नहीं हैं. हम तब जाते हैं जब हम, you know, वो stage गुजर गया होता है कि ना हम mammogram के लिए जाते हैं ना हम अपने आप को check
Or
करते
हम
हैं.
ignore नहीं कर सकते, but it's hurting too much or it's getting in the way. So why is it important that we speak about cancer?
Sorry, say that.
Why is it important that we speak about cancer?
Very common now. It is very common.
Yeah, save lives definitely. So ये होता है ना कि हम, especially हमारी communities में, हम कैंसर के बात नहीं करते, ऐसे हमें डर लगता है अगर हम कैंसर की बात करते हैं। तो अगर हमारे पास डायबिटीज़ हो या हार्ट डिजीज़ हो, हम बिल्कुल ये कह देते हैं सामने सारों के सामने कि अगर हम ये नहीं खा सकते, हमारी डायबिटीज़ है, या हम नहीं खा सकते, हार्ट की प्रॉब्लम है। मगर जब कैंसर होता है हम कभी किसी को बताते नहीं है। तो जब हमें पता होता है, ये पता चलता है कि उसको जैसे कोई किसी को कैंसर हो, पता चलता है कि उस औरत को या मर्द को कैंसर है, 6 वीक्स बाद वो फोत हो गए, तो हम फिर ये सोचते हैं कैंसर और हाँ, ये नहीं हमें पता कि उन्होंने कब चेक किया, कब उनको हुआ था। ये इसी तरह हमारे फिर मेंटली हम सोचते हैं कैंसर डेथ। मगर आजकल ऐसी चीज़ें होनी नहीं चाहिए हमारे लिए। अगर हम बातें करें, हमें डिस्कस करें ये साइंस एंड सिम्टम्स, तो इंशाल्लाह हम सारे ठीक हो जाएंगे। तो कैंसर बिल्कुल जैसे डायबिटीज़ या ये हार्ट डिजीज़ है, बिल्कुल वैसे क्रॉनिक इलनेस है। तो अगर हम बात नहीं करें तो हमें पता नहीं होता। अगर पता ना होता फिर हमें फिर बहुत लेट स्टेज पे हमें फिर डायग्नोज होती है। जैसे नबीला कह रही थी, हम इग्नोर करते हैं, हम सोचते कुछ नहीं है, कुछ नहीं है, कुछ नहीं है। तो जब हम फिर मुश्किल हो जाता है, हम इग्नोर नहीं कर सकते, फिर उस वक्त हम जाते हैं। जब उस वक्त जाते हैं हम स्टेज 3-4 पे होते हैं, तो फिर शायद ब्रेस्ट उतारना पड़ता है, कीमोथेरेपी करनी पड़ती है, ऐसी चीज़ें। तो ज़्यादा अच्छा नहीं है कि हमें पहले पता हो जाए तो हम ये चीज़ें ना हो हमारे साथ। तो क्या साइंस एंड सिम्टम्स, और ऑल्सो हमें पता चल के कहाँ जाना है हमने इंफॉर्मेशन लेने के लिए। अगर हम एक दूसरे से बात करें फिर हम ऐसे कर सकते हैं। नबीला, might get you to just do this one. I'll keep walking. Okay. तो हमें पता है कैंसर क्या है? कैंसर क्या है? It's a disease, yeah.
कोई थिक हो जाता है, कहीं भी कोई थिकनेस,
हाँ, lump हो सकती है या
Abnormal growth of cells.
yes, the growth of cells, yes. So cancer is हमारी बॉडी जो होते हैं, हमारी बॉडी से सेल्स बहुत होती हैं। तो ये सेल्स हमारी ग्रो होती हैं और वो फिर मर जाती हैं। तो कभी कभी ये सेल्स ग्रो होके मरती नहीं है, तो वो सेल्स हमें पता नहीं क्यों होते हैं ऐसे। ये बहुत रिसर्च हो रही है पता करने के लिए कि क्यों नहीं हो रही। तो वो सेल्स जब नहीं मरते, वो उनको हम रोग सेल्स करते हैं, तो वो सेल्स बन सकते हैं कैंसर की। तो ये स्क्रीनिंग प्रोग्राम्स उन सेल्स के लिए है कि हमें, जैसे हम आंखों से नहीं देखते, हमें साइंस एंड सिम्टम्स कभी भी नहीं होते, मगर हम जा रहे हैं और वो देख सकते हैं मैमोग्राम से, या जो हम डिफरेंट स्क्रीनिंग करते हैं, देख सकते हैं अगर कुछ है वहाँ जो हमें पता ना हो, तो वो अर्ली डिटेक्शन।
अगर वो जैसे फैट की में गिल्टियाँ होती हैं,
सिस्ट वो नॉर्मली कैंसर की नहीं होती, ये हो जाती है।
लेकिन मोल जो होती है ना, मोल कैंसरस होते हैं
जी,
All the moles.
मोल्स हो सकती हैं अगर मोल है। अगर आपके पास मोल है जो काफी सालों से है और वो शेप चेंज हो रही है या डिफरेंट लग रहा है, फिर वो चेक करें। अगर नॉर्मल मोल्स ठीक है, मगर कोई चेंज हो वो फिर चेक करनी चाहिए। I can't even see that now. Right, I'm going to stand on this side.
Yeah, it's probably in blue.
I don't know. So what we know about cancer, 1 in 2 people are affected by cancer in their lives. That means that either we have cancer, someone we know, a friend or family will have cancer. So if you look at how many people in this room, 1 out of 2 of us will know someone that's had cancer, a family or a friend, or we might have cancer ourselves. So that's a really big number there. Knowing that actually cancer doesn't mean death anymore. We've got Christie's Hospital, we've got the best surgeons in and the best research happening with Cancer Research UK, that actually it doesn't mean death anymore. So if I say to you breast cancer, what's the survival rate? So how many people live out of 100 people? If 100 people have it, if we catch it early, how many people will survive out of 100? Guess.
More than 80%.
So 40%. Who said 80%? Someone said 50. Anybody else?
I think more than 50%.
You say more than 50%, yeah? Anybody else? So it's actually 95% chance of survival. 95%. So actually, in this day and age, no one should be dying of breast cancer. 95% of chance of survival if you catch it early. That 5% sometimes, Nabila, is that
Yeah,
because
ये
it's
genes, yeah,
it's a
because
gene.
हमारी सबकी genes different है. हम सब इधर बैठे हुए हैं. हमारी सबकी genes different है. और हर रोज इतने से कह ले उंगली के हिस्से में billions and billions of cells die and new ones come. So when those new ones, like Farzana mentioned, when those new ones are getting made by our bodies, one of those cells becomes a rogue cell. So that's why, we know, and so everybody's cancer is different. So if I say I've got breast cancer, Pfizer says I've got breast cancer, our breast cancer is still going to be different. Our treatment's going to be different. Our chemotherapy is going to be different because वो हमारी cells के हिसाब से वो करेंगे. So that's why sometimes when we say they're doing a lot of research, we've just been on a 2-day brilliant conference that was by Greater Manchester Cancer Alliance. We've got the best at our doorstep. Christie's is one of the best in the world. And the research that goes on, we can't go wrong. But we need to get there early.
I don't know if you can see that picture. So
Yeah.
that's just showing about the cells. So then the cells kind of replicate. So when you've got those cells that don't die, then they start replicating. That means they're becoming more and more, and that's where they come together, and that's where you get the lump or obviously the cancer. So anything that's not normal for you, you need to get checked from your GP.
Does anybody know? Just ask him. Does anybody know how many different types of cancers there are?
That's later on, yeah. So if I say bowel cancer, we know what bowel is. Do we know what bowel is? Like our backside here. So if I say out of 100 people, how many people survive if we catch bowel early?
80 plus.
Sorry, who said 80 plus? Someone said 80 plus?
80 plus.
About 80 plus?
90 plus.
90 plus. Anybody else?
60.
60. So it's 85% chance of survival. So still, we're talking high number, we're talking over 50%. And then cervical, which is the women's private area, 100 people, catch it early, what is the survival rate? 90%. Pardon? 90. Anybody else?
90 plus 85.
80.
95.
95. Anybody else? I love the positivity coming from that area. 99.9% chance of survival. Yes. So if we catch that early, it's just really simple. All they do, they call you in and they just burn those cells. Sometimes a GP practice can do it themselves, or sometimes you get called to hospital, half an hour appointment, they burn the cells. You can actually go back to work or go and do your normal stuff. But I would say as women, we should use that excuse to lie down for a little while because we don't have that excuse. But 99.9% chance of survival. And that one, out of all the three, that is the one that ladies don't go to. Because obviously it's our private area, we don't want anyone looking in that area. But when we're having children, everybody's looking in that area, aren't they? So it's really, really important that we go. It's a 15-minute appointment, and I'll discuss that in a minute. It's a 15-minute appointment, and it can save your life. So as I was saying, actually nowadays, if you get cancer, it doesn't mean death. As long as we know the signs and symptoms and we act on those. So we need to know what is normal for our bodies and then see what's not normal. Because if we go to our GP practice and we turn around and say, oh, I've got a rash, and they'll be like, how long? Oh, I don't know. And then the GP tries all these other things. So they'll try a cream, and then they'll say, oh, you might have this, you might have an infection, and they'll try all these things. So you might be trying that for 2, 3, 4, 5 months, and then you'll come back and you might have developed another sign and symptom, and then they'll put you on the cancer pathway. But if you go to the GP and turn around and say, actually, last month I didn't have a rash, this month I have a rash, and it's lasted 3 weeks or longer, or whatever sign or symptom it is, the doctors think, right, clear change, there's a change, and that's a sign, and they will put you on that pathway, the cancer pathway, straight away. But if we are unsure, the GP is going to do things that they're going to try the easy way first before they put you on that pathway. Yeah. So it's really, really important that we know what is normal for us, and then we know what's not normal. And the other thing about knowing what's normal is what is normal for you is not normal for the person next to you. Yeah. So it's what's normal for you, not what's normal for your friends or whatever. So we need to constantly be looking at what our body looks like and I think we feel really, I don't know what the word is, we feel a bit ashamed or embarrassed to look at our bodies because we're always covering, aren't we? So we need to look at it, we need to feel it, so we're feeling for lumps or anything like that, and we need to see how it behaves. So when I'm talking about behaviour, I'm talking more about the bowel behaviour. So before I did this session, I didn't know how many times I went to the toilet and opened my bowels. Because when I need to go, I don't think I go 2 times a day or 3 times a day. So if that changed, if that behaviour changed, I wouldn't know. So you have to know how many times you go, and it's going to be different for each one of you. Some people go 3 times a day, some people go 3 times a week. It's whatever's normal for you. And then when that changes, lasts 3 weeks or longer, that's when you know there's a change, and that's that early detection that we can catch that early. If you don't know, then you're not going to know until you've got really bad issues or problems in that area. Yeah.
So maybe yourself, you would want it not to be.
Yeah.
So you would go there and say something different.
Yeah, so you wouldn't mention the word cancer, you mean?
Yeah, you wouldn't want that, so you'd want to see everything else before it's kind of, you know?
Yeah, and a lot of people do that as well because it's quite scary, and sometimes you feel if you say the word, you're going to get it.
Exactly.
But that's obviously, we all know that's not true, but you don't want to say it because you're scared of saying it. But by saying it, then at least you get put on the right way. And 9 out of 10 times that these signs and symptoms that I'm going to tell you for the other 2, it's not cancer. It's not, it's something else, but you'll get treatment for whatever that other thing is. But that 1 out of 10, that might be you. You don't know whether that's you or not. You know, God forbid it is, but if it is, you want to be caught, you want to catch it early. So as Nabila was saying, like sometimes you can't get an appointment with a GP practice. We all know that. So you're ringing them like, oh, you can come in 3 weeks time, or you know. But if you think it's one of these signs and symptoms that I've mentioned today, if you ring the GP practice and say, I think it's a sign or symptom and I want to alleviate, I want to make sure that I haven't got it, they have to give you an appointment that day or the day after. Yeah. So you become a priority. When you go to the GP and you speak to them, and if you're very clear about the sign and symptom, they have to put you on that pathway. And we have a 2-week referral, so within 2 weeks you'll get an appointment and you'll, you know, get diagnosed and be put on your treatment path if you need to, or cleared. So them things are really, really important. So if you take anything away from today, if it's not about the information, it's to know what is normal for you, and if it's not normal, see your GP. Because people believe that cancer is a punishment from God. So yeah, some people believe that. Some people believe that cancer is catchable. You can catch it if someone's got cancer. You've gone. Yeah, some people think it's like that. Some people feel that if it's in a family, so if 2 people in a family have got it, they don't want anything to do with that family because their daughters might have it, they don't want to get married into those families, and all those things are untrue. You can't catch cancer. So I did a session in Oldham a couple of weeks ago, and one of the ladies said, oh, well, I had, some lady passed away, she had cancer, I was pregnant, she said she was pregnant, she went to this lady who had cancer to go and see her, and everyone said, don't go and see her, because if you go, the child will get cancer. And then she goes, when the lady died, it was her auntie, so she said, I have to go, it's my auntie. The lady died, she went to the funeral. When the child was born, the child then basically had some health conditions, and everyone said to her, it's because you went and saw the lady. And she believed it, because she said, well, actually, the baby was normal, everything was fine, I got trouble after I went there. But actually that's not what really happened. The child was always going to get that. But then people then associate that and that together, then they tell somebody else, and everybody in the group going, that's really, and I'm like, no, that's not happened, you know, that's not true. So we have to start talking about it to make sure people realise them things aren't true. It's not a punishment from God. And like when I we work with the Afro-Caribbean community, they don't get treatment.
But it is genetic.
Yeah. So
and
yes,
very few cancers are genetic. Not all. Yeah. So even with breast cancer, like I mentioned before, अगर आपकी family में शायद सिर्फ 5% risk हो that is genetic.
Yeah, so it's like 3 to 5% chance that you got a risk of someone else. But if you have a bad lifestyle, you drink, you're overweight, you're eating processed food, you're eating too much red meat, you're not looking after you're not putting sun cream on every day, you've already increased your risk anyway. So if even this person's doing everything right in their genetics, you've already increased that risk more than they have. So 4 out of 6 cancers can be avoided if you change your lifestyle. So if 10 people got cancer, 4 out of those 10 people have got cancer only because of the environment that they're living in and the way they're living their lifestyle. So it's really important that we do that. And people do fixate on actually is genetic, and I'm not going to get it because we've not got it in our family, but anybody can get it.
Well, and can I just mention, men can get breast cancer. So 600 men get breast cancer a year because they've got breast tissue as well. So that's why it's important that they check, because there are quite a few Asian men have been diagnosed in the last couple of years with breast cancer as well. So it's important that we sort of like check. And also the very important thing is, I went to a research study a couple of years ago, and we say women carry the gene to pass on, like when it's genetic cancer. No, men carry the gene to pass it on to their daughters. So yes, so men can have the BRCA gene as well to pass on. So it's really important to know that it's not just women who are the carriers of the BRCA gene, men can carry that BRCA gene as well. So these are the kind of things, that with research, and luckily, like Faiza's mentioned, we have a lot of research going on in Manchester, because we've got the Christie's, the Research Centre, we've got the Manchester University, who are continuously doing the research. So it's important है कि हम मर्दों को भी, चेक करना सिखाएं. मर्द नहीं जाते, जैसे अब फायजा ये बाउल कैंसर का करेगी, सर्वाइकल का बोलेगी, थोड़े से प्रोस्टेट का भी होगा, it's because men don't go.
Okay, so I'm going to do a quick quiz with you because I'm talking too much and I like everyone to get involved. And if you get the answer right, I can give you a keyring. So when you go to Asda or Tesco's and you never have a pound, because we never have a pound, do we? Or if you go to the gym and you need the pound for the thing, this is it. You put it on your keyring, it's keyring, and you put it on, you take it off, put it in the thing, and you come back, and then you're never going to be without a trolley. You can't be like me holding 2 baskets like this. Right, okay, so put your hand up if you know the answer. Or if you don't want a keyring, we've got these. I already know the answer. Can cancer happen to anyone? Yes, it is true. Yes. So, what do you want, a keyring or a pen? I was going to say we've got pink pens. What?
Thank you very much.
Zayda, next time we go to the supermarket and you don't have a trolley, I'm going to be asking you. I'm going to be asking you.
Yeah. So 90% of cancers happen with people over the age of 50, but 1 in 2 people will be diagnosed with cancer in their lifetime. It might not be, it doesn't have to be in your genes, it doesn't have to be like your family's had it or anything like that. Any one of us can develop cancer at any part of our lives. Second cancer, can cancer be prevented?
Yes.
Yes. Yes. Yes. Yes. Okay. So 38% of cancers can be preventable. So 4 out of 10 or 3 out of 10 cancers can be preventable. And it's really important that we change our lifestyles and we understand. So when I say change your lifestyle, it doesn't just help with cancer, it helps with heart disease, it helps with diabetes, it helps with your mental health. So you might be changing it, but you're changing it and you're actually improving your overall health. So who said yes to that? Yeah. Oh, so I've got to give them to everybody now. And Nabila, you're going to have to be my assistant.
I was going to get some
here.
For you afterwards anyway.
Thank you.
Cancer can be prevented. So if we reduce the did I say cancer can be prevented? Yeah. So if we don't smoke, we eat healthy, we eat more fibre food. So we're talking brown rice, brown pasta, like wholemeal bread. And when I say brown, I don't mean when we make pilau and we brown it with the onions. I mean brown, actually brown.
Brown rice.
Yeah, people are like, I eat loads of brown rice. I'm not that type of brown rice. Sorry, what were you going to say?
No. I just want my keyring.
Oh, you're keyring, yeah.
I need a keyring. She wants a keyring.
So keeping a healthy weight, is also really important, and being sun safe. So what we think is when we get sun cream out is for that 2 weeks we have in August that the weather's warm, depending on where you live in the country, we might even get 1 week, and that's when we put sun cream on our faces, and we got children putting sun cream on our children. But actually, pardon? It is important, but actually what's more important,
I'm 70 plus, I never use sun.
but you should.
Very well.
Yeah. But you should use sunscreen. So they say,
There's only a tiny drop. You only just need to use a tiny drop on your face, 50 plus factor, just a tiny drop. You know, and sometimes when you get lotions, moisturising lotions, they have sunscreen in them. So if you don't want to use it separate, you can get the one with the.
and you should use it every single day. So don't think whether the sun's out, or don't think you've gone to like Dubai on holiday and you need to put it on there. It's every single day. Sorry.
Like I was born and raised in Pakistan, and I heard when I was in Pakistan that using sun cream could cause skin cancer.
No.
So I have that in my mind, and I mean generally I have that
just
fear in
mix,
my mind. I avoid buying it for my kids.
No.
Can I just comment on that one?
Yeah.
Because obviously I've worked in the beauty industry for over 20
Oh, right,
years.
there's So we've got a beautician here.
So when you're looking for sunscreens, always look for products that are parabens free. So many years ago they did make sunscreens with parabens in them, but now whenever you look for a sunscreen, if it's parabens free, because you know over the years historically we've used so many products without knowing that certain products that were good for you in one way but they had carcinogens in them. So now there's a lot of awareness of that. So whenever you're buying a product, if it's parabens that, you still need to be using SPF 30 as a minimum. Because in the winter when the sun filters through the clouds, it's worse than the summer sun.
Yes.
So always, all year round, use SPF, even in the winter.
So every single day, even if it's not sunshiny, we need to make sure. And nowadays, every moisturising cream that we have has SPF in it anyway. So it's really important when we're buying it, we just make sure that we get that one, because no one wants to put 2 creams on. And we all know once you put the sun cream on, when you put no moisture, you put sun cream on, then your face is just white for like a few hours. Do you know what I mean? Some of us like that look, some of us don't, I don't know. And just keep physically active, so go out, go for walks, and it's really good for your mental well-being as well. So 2 things that we can't change are our genetics, as we were saying, as you said earlier. If it's in your family, then we obviously you've got a 3 to 5% more risk of getting it. Doesn't mean you're definitely going to get it. It just means your risk increases a little bit more. And age. So the older we get, so when we know when you hit the age of 50 and above, you're more likely to get cancer than at a younger age. We're not saying at a younger age you won't get it. We're just saying over 50 you're more likely to get it, and that's why a lot of the screening programs are starting at that age. So we can't get to 49 and say, right, that's it. I don't want to be 50 and not be 50. We do all want to say that, but you know, we can't stop our age. So they're the 2 things that we can't change. So, I don't even know if I've got any key-rings left. Survival from cancer is better now than 40 years ago.
Yes. True.
So who's not got a key-ring? Yeah. All right, so who said true then? Did you say it? Here, she said it. It was her, she said it, she said it. It was her, she said it. It was just her. So cancer survival.
You can only have one. You can't have another one. You can only have one.
You can have a pen. You can have a pen. We'll give you a pen free at the end anyway. Right. So cancer survival in the UK has doubled in the last 40 years. That's because we've got Cancer Research UK doing all these research behind, you know, the treatments and why we're getting cancer, the different types of cancers, and there's so many different types of cancers. So actually, if you get cancer now, you're better off than you were 40 years ago. And we've got Christie's Hospital, and when we were at this conference, they were talking about how amazing Christie's Hospital is, and all the procedures and all the consultants and people from all over the world actually come to Christie's Hospital because it's they're really progressive hospital. If it's unusual for you, go and see a GP. Early detection saves lives. And cancer screening saves lives because we catch it early. So, as we talk about cancer screening, it's for people that are healthy. that have not got anything wrong with them. So if you've got a lump, or if you've got a rash, or you're going to the toilet more regularly, then actually you don't need to go through the screening program. You actually need to go to your GP, and it's a faster route to be diagnosed than going through the screening program. So it's really important that if you have a sign and symptom and then you get a letter for screening, you don't think, oh, I'll wait for that. And it might be 2-3 weeks time, say, oh, I'll go when, and they'll check then. Actually, ring your GP and go and speak to your GP. And it's for healthy people. And that's why people don't go. They think, well, there's nothing wrong with me, and I've got so many other things to do. I haven't got time to go to that, because there's, but it's what's happening inside our bodies that we don't know about. So as it's saying, it finds signs before cancer, before it turns into cancer, or that early detection. So when it's just changed, basically, or then the treatment can be successful. So what are the reasons why people don't go for screening? I want to ask you. I've got a list here. You can't see that, sorry, but we know we've got things like language barriers, transport, childcare. Sometimes people just don't want to go. Cultural reasons. So a lot of people don't go for cervical because of cultural reasons. And just they don't think it's important.
Sometimes
so it's the fear. Yeah, definitely, it's the fear. You get scared that if something comes up, what's going to happen. Yeah.
At what age do they start doing this cervical?
I'm going to tell you in a minute. I'll tell you that in a minute. So why are the reasons why Asian women don't go for screening?
Yeah, they're scared.
I think it's fear.
Is it fear? Is it fear of knowing, or fear of actually having the procedure?
Fear of knowing.
Fear of knowing.
I think Asian women are very ill-informed.
Right, okay.
They don't understand, like you said, at the very initial stage, you don't go through the whole removal of the breast. And I think mostly it comes into the mind that if it's diagnosed, it's straight away.
Yeah.
And I think that's one of the vanity factors as well. Women want to look beautiful.
Yeah,
they want
of
to
course,
train.
yeah.
And I personally think that could be the reason why.
Yeah, it could be, definitely.
Religion is a very big factor.
Okay.
Faith, they're very shy.
Yeah.
That they wouldn't want to go.
So that would be more cultural, wouldn't it? It wouldn't be religious, it'd be more cultural, isn't it? Yeah. And I think, you know what it is, because it's like we don't actually look at our private area ever, because we don't need to look at it. Hit the age of 54, and you're registered with a GP, you'll get a kit to your house. And that kit will check whether you may have signs. So the kit looks like this. Has anyone had it?
Yes.
Yeah. So it looks like this, right? Someone's laughing. So on the top of this, I'll actually send it round so you can have a look if you want to open it and just have a look and pass it round. So on the top of this, we've got a ridged area here. And what they want you to do is put a little bit of poo onto this. Right? Not too much, not a big scoop and then put it in. Not like nothing, but just to fit that little area there. And they're checking for any invisible blood in the poo that we can't see from our eyes. So if we sometimes look down in the toilet and there's some blood, it's normally piles. So this is the invisible one that we can't see. So then this gets sent to you automatically when you hit the age of 54, and it gets sent to you every 2 years.
The back.
Okay. Yeah, send it back, Sarah. Do you want to send that one back as well?
Because again, just mentioned that was only the age of 40.
Yeah, so we are trying to get it down to the age of 50, so it used to be 60 to 74, but more younger people are getting it, so we're reducing it to the age of 50 eventually, but at the moment it's at 54. If you're registered with your GP, it will come automatically to your house, and you'll do it there, and men and women get this kit. The other screening programs are only for women. This one's for men and women, because men get really upset that we don't do anything for them. And I always think that they've done this for men as well, because men will never go to the GP practice, so we actually have to give it to them in the hands.
When you say something
and
about
it's important
men, they will
that
do it.
just mentioned, because it was from the age of 60. But because a lot of younger people are now getting diagnosed with bowel cancer, what was that newsreader, the newscaster that passed away, George Alagai? He's the one who campaigned to bring the age lower, because he was in his 50s when he got diagnosed and he didn't know anything about bowel cancer. So obviously he's unfortunately passed away now,
but he did survive for quite a number of years. But that's why, so every 2 years we're going back from 60, 58, 56, 54, 52, so until the whole country, once somebody reaches the age of 50, we'll get a bowel screen.
Because I think that's the most important thing here. Because we're thinking we're going to get it all over our hands, we're going to get it all over the bathroom, we're going to break our backs trying to collect it. So how do we do it? So what you do is, you know, if you go to like Asda, Tesco's or wherever and you get a punnet of strawberries or anything like that, your takeaway tub that you go, because Nafis is just open there and I'm sure you're all getting takeaway tubs. So takeaway tubs, and you put that, you line it with loads of toilet paper, you have your little wee first, and then you put it in the toilet, and then you do your business on there, and then you clean yourself, come off, and then you just take that pot out, take a little bit out, then you grab the toilet paper, put it in the toilet, flush the toilet, and get rid of the plastic tub. Really easy, no over your hands.
Put a big carrier bag.
Yeah, you could do that as well. You could do the big carrier bag if you want to do the big carrier bag. But the only problem is disposing of it.
No, it's just no. Somebody's trying to bring a flushable out.
Right.
Nova's got some samples.
Oh right. Right. So the only problem is if you do it in that, then you have to close it, and then you have to leave the house and go put it in the outside.
Yeah.
And it's better if you just do it on toilet paper. You could just thingy it and flush it in the toilet.
Common sense.
Yeah. So the next one is cervical, which is for women aged between 20 and 64. So this is a women's private area, and this is when you get called to your GP practice. So you'll get a letter saying you're due for your cervical screening, you need to ring and you need to make an appointment with your nurse. So between the age of 25 and 49, you get called every 3 years. From 49 to 64, you get called every 5 years. And after 64, we were at a conference yesterday. They were saying they're gonna start doing urine tests to check whether people may have cervical cancer. Now you go to GP practice, you get this done. Normally it's for people that are sexually active. Yeah. So you've had partners, and it's normally for people like that. But if you hit the age of 25 and you're not married and you've not had a partner, it's still important that you go and have a conversation with your nurse to see whether you want to. So I don't know if you've seen this. So this is what we're going to pass it round. This is what a speculum looks like. So what we're doing here is we're checking to see if there's any cancer cells in that area. So what you'll be asked to do is remove your clothes from bottom down, lie down, and they will put this speculum inside you to open up your cervix, and it'll be like a long cotton bud with a little bush on the top, and they just scrape a little bit of the cells at the top of your cervix, put it in there, and then they send it off. Within 2 weeks you'll get your results back, whether it's positive or negative. If it's positive, actually you just need to go either to GP practice or to the hospital and get them burnt off. So it's not a big procedure, and 99.9% chance of survival.
Different sizes.
Yeah.
I have a question about pancreatic cancer, which is no signs, nothing.
Yeah.
I've seen 2 people die with no symptoms.
Well, sometimes the symptoms are there. Sometimes there is silent cancers. Sometimes cancer can be growing in your body and you don't know, regardless of whatever test you go for. Sometimes you can go for a scan, CT, MRI, and sometimes the body will not pick it up. Those scans will not pick it up. Those are sort of the hard to diagnose cancers, and unfortunately that can happen. Pancreatic is again one of those silent cancers, but it's again, like Pfizer's saying, we explain, it's knowing what's normal for you, for your body. Like you say, sudden weight loss. You're not on a diet. Yes. Sudden weight loss, blood from when going to the toilet, anything like that. Pain in your stomach that is not normal. A headache that doesn't go away. A cough that doesn't go away. Anything that is not normal for you, you need to go and get it checked out. If within 2 weeks the symptoms haven't gone. So even like Pfizer's talked about the cervical. It's like you say, any of the cancers, ovarian for women is very a silent killer. It only gets diagnosed in A&E. So it's understand that you need to go, if there's a bloated mist that doesn't go away, you need to go and say to them you want an ultrasound or a scan to get it checked out.
My friend died 4 months ago. She was just losing weight.
Yeah.
She said, I went to see my doctor that I don't look so beautiful as I look when I was healthy. So they start, they tested, and they found that she had a pancreatic cancer.
So it's like saying
she had a surgery, she survived, but suddenly she died in 3 weeks. Then
it's just sometimes
1
we
year
treat
after
cancer.
surgery.
Yeah, sometimes what happens is when they find the cancer, they treat it depending on surgery, chemotherapy, radiotherapy. But sometimes then your body becomes immune or used to हो जाती है वो दवाइयों के. So when the cancer comes back, it comes in a more aggressive form because उनको पता है वो दवाई जो पहले थी वो हमने उनसे लड़ना है. So it comes back in an aggressive form. But like I said, survival rates are more if you go early diagnosis. Like the government agenda now is by 2028 we want to diagnose 75% of cancers at stage 1 and 2.
So I've just sent across the speculum that goes round. Now that comes in different sizes, so it depends what your size is in that area. So if it's hurting, it shouldn't hurt. If it's hurting, they put the wrong size in. Automatically they'll put the medium in, but some people might be small there, some might be a bit bigger there. So it's really important that you tell them that if it's hurting. If you've had any trauma while like maybe childbirth or something's happened to you when you were younger and you feel uncomfortable about that area, you can make a double appointment. So normally you get a 15-minute appointment with your nurse, but actually you can make a double appointment like a 30-minute appointment, and they will talk you through it. At any time in any of the screening process, you can say no. So even if you're there and they're just about to get your screen, you can say I'm not comfortable, and they can stop, and that is your right. And it's really important to know that that actually is your right, because people go and they get really scared, they don't want to say no, and then they have a bad experience. And we know if you have a bad experience, one person tells 10 people, 10 people tell another 10 people, and that cascades round, and you will never go again.
And also, can I just mention, under 25, if you have any symptoms like discharge or abnormal bleeding, you need to still get that checked. Because ये test to 25 के बाद आएगा, but under 25, if you have had any tests, again, हम कहते हैं और शादी-शुदी लड़कियां नहीं है तो उनको ये नहीं कराना चाहिए. It doesn't break anything. आप तो गाड़ी चला सकते हैं, go horse riding, bicycling, right? You can break your thing, but it doesn't, because these new ones, because they're not like metal anymore, so it doesn't break that height. But it's really important to say culture, because कई कहते हैं नहीं culture हम मज़हब में नहीं है, पर मज़हब किसी मज़हब में ये नहीं लिखा कि आप अपनी जान को नहीं बचाएं. It's a lot of we did it a number of years ago as well. It was a big thing that again, like breast, people do not come for their cervical. It went down to 37%. That Asian women were going through it. So it's really important. So even under 25, if there's any signs and symptoms, your daughters have got any signs and symptoms, they're okay, or shadi shuda, you need to go and get them checked out.
Because you can still get it if you're not married. So the signs and symptoms of bowel is any change of habit. So if no matter how many times you go, if that is more or less and lasts 3 weeks or longer. Sometimes when you go to the toilet and you've done everything, and then you walk out of the toilet and you think, actually I need to go back in. So that could be a sign. Blood in the poo normally is piles, but always get that checked out. If you're losing weight and you're feeling tired and you're not on a diet, or you've not been exercising or going for a run and you're feeling tired, and that lasts 3 weeks or longer, go and see your GP. And if you feel a mass like a lump or something in your stomach or the back area, then go and see your GP. With cervical, it's any unusual bleeding from the private area that's during or after you have relationships with your husbands. If you have any periods after menopause, and any unpleasant smells or any discharge from that area. So sometimes what happens is when we're on our periods, in between we get a little bit of spotting, and we like, oh, I think we're starting now. We're gonna start our period, and then we don't, and then we forget about it, and then we start 2 weeks later. Actually, that might be an early sign of something like that. So it's really important you see the GP. As I was saying, 9 out of 10 times, it's not cancer. It's something else. It might be a UTI, or it could be something else. But it's better to get checked out. It's better that we catch it early. And I know, as you were saying, like some women don't go because they think, oh my God, this is really scary, I don't want to know. They're eventually going to have to know. So it's better that they know now, and we can do the treatment and save you, and you can live a healthy life with your family, your children, rather than actually catch it late and they see you deteriorate and you deteriorate yourselves as well. So it's really important that we do that. And sometimes we don't have time. Time's really an important thing. Because as women, we've got children, we've got husbands. Husbands are more children than the actual children. Yeah. Husbands, we've got our parents, we've got our friends, our communities. We don't actually have time to go for anything when we're feeling normal.
Faiza Chaudhry and Nabila Farooq for having a brilliant session. So can we just give a big round of applause for them? I'd like to give a special thanks to my Prettyman's media team, CMM. We've got Rubina Raja here. I'd like to invite Rubina Raja, Alia Hashmi, and Saira Punawala, and Kausar. Please come forward. And Pinky Vishalaki. They're mashallah my very committed team. And without the help and support of my team, there's nothing possible. So they make everything possible. They are carrying out my vision, and we are developing ideas together. So another round of applause for Prettyman's media team.
The breast reading.
Yeah.